Good morning, everyone. I'm Kathleen Toomey, the Commissioner of the Department of Public Health. Yesterday, the Governor and I had the privilege of meeting with the White House Coronavirus Task Force Coordinator, Dr. Deborah Birx, and the CDC Director, Dr. Robert Redfield. We had conversations about a wide range of COVID-19 topics, but none more timely than getting our children back to school. Throughout the last 2 weeks, I've spent countless hours talking with educational leaders around the state. Everyone agrees that for the future of our children, we must do everything we can to have them back in a learning environment again this fall. Working with State School Superintendent Woods, educational administrators, and school boards around the state, we have crafted guidelines for schools that I'm very proud of, because it took the assumption that we will open schools, but we'll do it very, very safely and ensure that schools have the tools they have to protect the students, the staff, the teachers, as well as the community as a whole. We know and fully expect that there will be some cases of COVID among students and teachers, and we are doing everything we can to provide the resources that needed to protect everyone in the school setting. Working with GMA, schools are receiving allotments of PPE in the coming days to prepare for reopening. Just as we know that it's in the best interest of students to go back to school, we also know that schools need to be prepared to respond to cases in the classroom. And we have worked diligently to develop guidelines so that local public health or the state public health department will work closely with schools to follow up on any cases. We are working and reassuring that a single case of COVID does not require that a school shut down. And we have our team of contact tracers, almost 1,300 at this point, that can quickly identify and isolate close contacts and continue the educational experience for the students not exposed. We do know that children under the age are at low risk for severe complications of COVID, and based on our data, that's been reinforced. And we also know, however, that when children are not in the classroom, they can suffer from many sorts of developmental challenges. We want to do everything we can to ensure that our kids have the opportunity to have these learning experiences this year. So please, work with us, work with your communities, and do the simple things that we know work to combat the spread of the virus. Yes, wear a mask, wash your hands, maintain social distancing, and work with us to help get our kids back to school this fall. Right now, we are seeing an increase in COVID in communities throughout the state, in many settings, both not just in urban Atlanta, but also suburban and rural areas. Our test positivity rate on average is 13.6%, which reflects community spread at this time, and hospitalizations have increased 39% over the past week. Gwinnett, Fulton, and DeKalb counties have the highest number of new cases over the past 3 weeks, accounting for nearly 26% of all new cases in the state. We continue to see outbreaks in workplaces, in businesses, in congregate settings, daycares, camps, fraternity houses, many churches, and any place where there are a large number of people gathering. And among our most vulnerable populations, long-term care facilities, we have seen some outbreaks. In all these cases, we absolutely, very quickly, once identified, begin our intervention, begin our follow-up with our local health department to ensure we do contact investigation and contain the spread wherever that may be. It's critical that we take personal responsibility and practice social distancing, wash our hands frequently, and wear a mask when out in the community. Cloth face coverings are one of the most powerful weapons we have to slow and stop the spread of this virus. Wearing a mask prevents an infected person from spreading COVID-19 to others and is the best protection we have. And it's better when we all are wearing masks. We are not only protecting each other, protecting our families, protecting our community. CDC published a very interesting study this week that I'm sure many of you saw, which showed the impact of wearing masks. And Dr. Redfield and I talked about that, and it just reinforces again the importance not only of all of us wearing masks, but the executive orders that we have requiring wearing masks in business settings. There are now more than 170 DPH COVID-19 test sites statewide, and overall testing throughout the state has increased extraordinarily since we first met a number of months ago. We're collecting on average more than 14,000 specimens a day, and I'm extremely grateful to the public staff, health staff who've been working statewide long hours, often 7 days a week, in the heat, in full PPE. They have been doing this for months. They are totally committed to their communities and to helping us stop the spread of this virus. However, we acknowledge we do need more testing. We are working to expedite it and improve our testing system, but at the same time, we also recognize that the lab capacity needs to be improved. Many of the commercial labs are not returning tests in a timely way. It takes as long as 2 weeks or longer to get a test back, and as I've said before, that delay is unacceptable, and it's unacceptable both for the individual infected, but also for us to do the prevention interventions we need to do to protect the community as a whole. I have spoken to the governor about this, and he shares my concerns, and we are working not only to increase our testing capacity, but to bring on an additional lab to help improve our turnaround time. I've talked to you several times about contact tracing. We have really ramped up those efforts statewide. And we have close to 1,300 contact tracers currently on board, and we are going to bring on additional to be a total of 2,000 contact tracers in the next several weeks to reflect the need to have increased capacity as we have increased cases. To date, we have interviewed more than 40,000 individuals with COVID-19 and have identified over 86,200 contacts, and we will continue to do that even as we continue to see cases. We need the continued support of the community to make contact tracing successful and to stop further spread of COVID. And so please remind everybody, when you get that call from DPH, when we reach out to you about contact tracing, answer the call, work with us to make our contact tracing successful and our efforts to stop the spread improved. But most of all, please, social distance and wear a mask. Those are the things that we can do to stop the spread at this time. And thank you for your support.
Good morning. My name is Homer Bryson, and I'm the director of the Georgia Emergency Management and Homeland Security Agency. At GEMA, we continue to work with our vendors, state partners, private partners, and volunteer organizations to provide the necessary resources for Georgia's response to the COVID-19 pandemic. As of today, the public health state of emergency has been ongoing for 125 days and is the longest emergency activation in the state in memory. To streamline delivery operations, we recently established a partnership with UPS to ship PPE directly to our customers. By leveraging their existing logistical and distribution networks, we can distribute supplies faster and free up personnel to prepare Georgia for any other emergency. This is especially important as hurricane season began in June. UPS has delivered 3 mailing system terminals to the Department of Public Health warehouse and trained state employees to operate the systems. During this transition period, approximately 850 packages of PPE, testing materials, and decontamination foggers were distributed to over 200 entities. That's about a 4-day period. Medical facilities and nursing homes request resources through the Department of Public Health Ready Op system, and local governments and critical infrastructure partners request resources through GEMA's web EOC portal. To date, the state has processed more than 26,470 resource requests. Approximately 80% of those requests are related to PPE, and we have delivered PPE to over 2,700 entities in the state of Georgia. To put that number in perspective, during Hurricane Michael, GEMA processed 1,051 resource requests. As part of completing these requests, Georgia has distributed approximately 7.9 million N95 masks, 9.3 million surgical masks, 2.7 million gowns, 24 million gloves, 485,000 Tyvek coverall suits, 1.3 million face shields, and 172 ventilators. To keep Georgia moving forward, GEMA is fulfilling requests from critical infrastructure essential workers. To date, over 2.1 million face masks were delivered to transportation, energy, telecommunications, government, water, wastewater, and food processing sectors throughout the state. Over 1 million cloth masks were provided to over 40 counties for public distribution in hotspot areas. This brings the total to more than 3.1 million cloth face masks to protect the citizens of Georgia. Additionally, 10,000 no-contact infrared thermometers were distributed to 16 local emergency management agencies that were identified by public health as having the greatest need. GEMA continues to support the Georgia Department of Education in their efforts to help safely reopen schools. We have already coordinated the distribution of 2 million cloth masks and 3,000 non-contact infrared thermometers. A second distribution to schools will include 100,000 clear masks for deaf and hard of hearing students and teachers, 1.5 million youth-size cloth masks, 1 million three-ply disposable masks, 16,000 reloadable no-touch hand sanitizing stations, 290,000 gallons of sanitizing gel, 62,400 packs of sanitizing wipes, 50,000 face shields, and 15,000 isolation gowns. In addition, at the direction of the governor, we are procuring 3,000 decontamination foggers and 12,000 gallons of solution to be distributed to the schools in addition to the PPE listed. To address the concern of medical bed space and in coordination with the governor, we have an 80-bed facility on standby in Milledgeville and are in the process of standing up a 120-bed facility at the Georgia World Congress Center. Each facility will be ready to receive patients if the need arises. In addition, we have 4 temporary medical pods located at Phoebe Putney Hospital in Albany, Floyd Medical Center in Rome, Navicent Medical Center in Macon, and the Northeast Georgia Medical Center in Gainesville. In total, these pods provide an additional 88 medical beds to supplement hospital capacity. Making all of this happen has required incredible effort on the part of all of our employees and state partners, and I wanted to take a moment to acknowledge their countless hours and hard work spent working to keep our citizens safe. And we remain focused, and we recognize that what we do daily affects the safety and the lives of our citizens. And with that, I'll turn the podium over to Commissioner Frank Berry, Department of Community Health.
Good morning. Before I get started, I want to certainly recognize and thank the frontline workers who are helping us battle this illness. We greatly appreciate their service to the state of Georgia. I'm here to talk about staff augmentation for nursing homes, hospitals, and for our state hospitals through the Department of Behavioral Health and Developmental Disabilities. To date, we have 15 hospitals statewide with a total of 417 healthcare providers. We've partnered with Healthcare Workforce Logistics, otherwise known as Jackson Healthcare, to help staff these hospitals. Nursing home facilities, we have 54 nursing home facilities statewide with a total number of 302 healthcare providers in those nursing home facilities. And of the 5 state hospitals that I mentioned, 251 healthcare providers are providing care in those facilities. We also have 1 community living home down in the southwestern part of the state where we are providing staff as well, for a total statewide number of 970 healthcare providers. The second biggest issue that we were challenged with was in our nursing home facilities related to surveying work. The CMS required that we complete 358 surveys by July 31st for focused infectious disease control. Of those 358, 291 have been completed, with 67 remaining. We should be on target to meet that July 31st deadline. We have partnered with 2 private companies to assist us. So with the Healthcare Facilities Regulation Team, along with CMS support, along with those 2 companies, we will meet that July 31st deadline. The additional component that we did to help with the nursing homes is 257 nursing homes are participating in the Temporary Nurse Aid Program. That was an initiative where we partnered with CMS to provide online training so that we could get more staff involved and engaged in supporting the residents that live in those nursing homes. That has been a significant success so far. As people have gone out with the illness, we've been able to replenish those staff by using those temporary nursing aides. I'll be happy to answer any questions at the end, and thank you very much for your time.
Good morning. I'm Major General Tom Carden. I serve as the Adjutant General for the Georgia National Guard. The Georgia National Guard continues to partner with the Georgia Emergency Management Agency, the Georgia Department of Public Health, the Georgia Department of Community Health, and others to execute Governor Kemp's intention to keep Georgia citizens safe. We've done now more than 2,400 infection control missions in the state of Georgia, most of which were in a long-term care facility. We continue to support the Department of Public Health with respect to sample collection at their static collection sites. In addition, we provide mobile sample collection capability as needed by Dr. Toomey and her team. We continue to work at more than 10 food banks across the state of Georgia, where we supported the movement of more than 89.5 million pounds of food and 41.1 million prepared meals. In addition to all that, we continue to do detailed contingency planning to make sure that your National Guard is never late to need. It's certainly our honor to serve our governor, this great team, and our citizens at this critical time in our fight to defeat COVID-19. Thank you very much.
Good morning, everyone. My name is Richard Woods. I'm the State School Superintendent of Georgia. Before beginning, I want to thank Governor Kemp and Dr. Toomey and their respective staff for the collaboration that has taken place since the beginning of the pandemic. I do want to especially thank perhaps 2 members that have worked behind the scenes and with my staff from the governor's team. This is Ian Caraway and Miranda Williams. They have done a wonderful job in maintaining contact with us so that we could be on the same page throughout this whole endeavor. Obviously, as we look at starting back to school, needless to say, this is probably the most challenging back to school time that we have ever seen. The decisions all of us in our districts are having to make are not easy. There's no obvious playbook that we can follow, no guidelines that we can look at, and probably no historical reference that we can pull from to say this is what we're doing is the best and right thing. But I can assure you, we are doing the best that we possibly can at this time, and what is right for our students and our teachers. What I do know, and I think most would agree, is that we want our school or students to be physically back in school. That is the best place for them to learn. There's no doubt when you talk with everyone, this is the ideal situation. But we also know that relationships are better formed in person once they are in school as well. But that being said, the safety of our students and our staff will continue to take precedent in all our decision making. And that is something we will never let our guard down, whether we're in the presence of COVID-19 or any other thing that we face. To that extent, the Department of Education, in collaboration with the Department of Public Health, has released guidance as far as restarting schools for the 2021 school year. We have also released support documents from the Governor's Task Force groups to further support the districts as they plan for reopening. These documents lay out foundational guidance for reopening schools in a face-to-face instruction, a mix of face-to-face and distance instruction, or a solely distance instructional model. This information is available on the Georgia Department of Education's website at gadoe.org, and there you can click on Georgia's path to recovery for K-12 schools for all information. So all the documentation that you have or need, you can find there on that website, and it is constantly updated. We currently have a few districts who are opting to open with a distance model only, but most are planning at this time to begin the year with a mix of face-to-face and distance instruction. We acknowledge the hard planning decision-making that has taken place within our districts. It is the goal of the Department of Education, in whatever instructional method that is out there, that we are going to support our districts and ensure that they are successful as we move throughout this school year. And in many cases, what we may find is that this may be fluid, but the plan that we have developed and the guidance we have developed is definitely flexible and able to adjust as need is. To support our districts, we have initiated some of the following throughout the past months. We have received waivers from the U.S. Department of Agriculture to meet the nutritional needs of students during the summer, and also as we continue to make adjustments to do so with the school year depending on the instructional model. Dr. Lynette Dobson has done a wonderful job, and I want to thank Secretary Sonny Perdue again for his work and ongoing support of our nutritional program. I think to date we have probably delivered over 30 million meals throughout the state to our families and students at this time. We also received a waiver not to administer high-stakes testing as we closed out the previous school year. In concert with Governor Kemp, and again I appreciate that very much, we have also sent a waiver request to the U.S. Department of Education seeking to eliminate high-stakes testing for the upcoming school year. At this point, we have many things that we need to focus on besides high-stakes testing. We need to make sure that our families are safe and secure, our students and our staff, letting them get back and adjusting and taking something off their plate that we can deal with later in a more appropriate manner is something that I think that is very valuable, and we encourage Washington, D.C. to accept this waiver. We are also introducing a non-high-stakes formative assessment tool called Beacon, and this will be made available to all districts so that they can support learning throughout this school year. We have partnered with the Governor's Office of Student Achievement, and again I want to thank Joy Hawkins, the Georgia Foundation of Public Education, again Paige Pushkin for that, and the private sector to provide grants and equipment to school districts to enhance connectivity. We have also allocated $3 million of the CARES Act fund to purchase up to 3,000 Wi-Fi transmitters for Georgia school districts. It is estimated that 135,000 students will receive connectivity through this effort. I want to thank State Board of Education Chairman Scott Sweeney and the members of the State Board of Education as they move to increase Georgia virtual capability to provide online classes for students throughout the state. Again, GEMA and Homer has already mentioned the things that they have done, so I appreciate that partnership in securing masks, sanitation stations, and also the temperature thermometers, I guess, that would be used to screen people as necessary. As I close, people I think are asking, what does the first day of school look like? I've been involved with education and I've opened up school 22 times in my career. The first day of school will be the first day of school. You can expect hiccups. You can expect challenges. But I guarantee you your kids will be safe, your teachers will be safe, and we will learn. This is just the first day that's a little bit enhanced because of COVID-19. A lot of things we'll be looking at will be new. Transportation, meals, student drop-off and pick-up, moving from class to class. So I do ask that everyone, please make sure you communicate with your school district. School districts, make sure you are communicating with your parents, making sure what does that first day look like when it comes to enrolling school or students at that time. We have to be prepared and we have to communicate. But I am sure of this, that we will be successful in having a great school year in the state of Georgia. Our districts have done a wonderful job in preparing. We have done a great job as far as putting out guidance and support. We are working as a team throughout this state, and we're going to beat COVID-19, and we're going to do so in a manner that is fitting for the state of Georgia. At this time, I would like to bring to the podium an individual who is a strong supporter of public education and a great partner in all things, and is an individual who has never hesitated to meet a request that has come from the Department of Education, and that is our Governor, Mr. Brian Kemp.
Well, good morning, everyone. Let me first thank everybody for being with us, and I certainly want to start by thanking Dr. Toomey, Director Bryson, Commissioner Berry, General Carden, and Superintendent Woods for their strong leadership during the pandemic. I also, like Director Bryson did want to take just a moment and thank your teams too. I know we don't do that enough, but they have been grinding away every day in the trenches. And for those of you watching this morning, thanks for all that you're doing. These continue to be challenging times in our state and our country, and the recent uptick of COVID-19 cases is literally from coast to coast. It's clear that this fight is far from over. We have come a long way since the pandemic begun, but we also have incredible challenges that remain in front of us. Over the last several weeks, as you know, we've seen a rise in cases, a rise in hospitalization rates, and a rise in the percentage of Georgians testing positive for COVID-19. Hotspots have been popping up at churches, manufacturing plants, and long-term care facilities, and as a state, we are literally tracking this data hourly. While much has changed, we also remain laser focused on protecting both the lives and the livelihoods of all Georgians. Early in this pandemic, we worked closely with hospital administrators to enhance surge capacity. We built a hospital within the Georgia World Congress Center to free up bed space. And as Homer was talking about, we delivered mobile units to targeted regions throughout our state. We've also identified facilities that could flex as patient populations increased. And now, as hospitalizations rise, we are rolling out our strategic plan that we've had in place for a long time to ensure that supply meets demand. Last week, as mentioned earlier, we reactivated the Georgia World Congress Center, which will serve as a step-down unit for area hospitals. We continue to work closely with members of the White House Coronavirus Task Force to plan for future needs. 2 weeks ago, we were honored to host U.S. Surgeon General Jerome Adams, and just last week I spoke with Admiral Giroir about testing capacity and supplies. Yesterday, I met with Dr. Debbie Burks and CDC Director Dr. Robert Redfield to discuss school preparedness as we head into the fall, as Superintendent Woods mentioned. And earlier this week, we announced that Piedmont, Atlanta will add 62 beds in the Marcus Tower. I want to thank Kevin Brown and his whole team at Piedmont, as well as the vision of Bernie Marcus and many other Atlanta philanthropists for their forward-thinkingness in planning this tower over 5 years ago. Moving forward, we will continue to add beds where needed. Because of patient profile and treatment options available, hospital stays are now shorter than they were when we first started. We are confident in our plan, which provides the best possible care without bankrupting our hospitals. Rest assured, safeguarding surge capacity remains a top priority of my administration. In the last several weeks, we have witnessed record demand for testing, as Dr. Toomey mentioned. While Georgia is reporting nearly 20,000 tests every single day, we know that more is now needed. We have more than 172 state-run testing sites open, and we will continue to partner with local and private entities to expand access in targeted communities. This was another area we discussed yesterday with Ambassador Burks and Dr. Redfield, and how the feds and the state can continue to work together on this issue. As many in this room have reported, national labs have become backlogged, causing many Georgians to wait days, if not over a week, for their result. This is simply unacceptable, and Georgians deserve better. In the coming days, we will announce a new regional partner who will expand capacity, adding 10,000 more tests a day and providing faster results. As I've said from the beginning, accessible, accurate, and timely testing are key to winning the war against COVID-19. We will continue to do whatever it takes to shake up the status quo and fix this pressing issue. As Georgia continues to boost testing, add hospital beds, deliver PPE, and provide medical staffing, I'm asking Georgians to do their part. After all, it's the community that defeats this virus, not the government. This has been a long, difficult battle for all of us. We have sheltered in place, we've had to distance ourselves from loved ones, and everyone has had to make incredible sacrifices along the way. But we now must reaffirm our commitment to flatten the curve. We need all younger Georgians to recognize the importance of following public health guidance, to realize that their exposure can have serious consequences on their loved ones. We must all do our part to stop the spread. Today, I'm encouraging all Georgians from every corner of the state to do 4 things for 4 weeks. 1, wear a mask when out in public or when you cannot distance yourself inside. 2, practice physical distancing. Stay 6 feet from those you don't live with. 3, continue to wash your hands throughout the day with warm soap and hot water. And 4, follow the executive order and heed the guidance provided by public health officials. If we do these 4 simple but effective actions on a daily basis, we will make incredible progress in the fight against COVID-19. We can protect our loved ones, we can revive our local economy, and we can continue to take measured steps forward. Now, I know that many well-intentioned and well-informed Georgians want a mask mandate. And while we all agree that wearing a mask is effective, I'm confident that Georgians don't need a mandate to do the right thing. I know that Georgians can rise to this challenge, and they will. And I know that Georgians will do their part to defeat this deadly virus. Last week, on a call with mayors and commissioners around the state, I issued a charge to local leaders, and I'll do it again today. Instead of issuing mandates that are confusing and unenforceable, I'm asking all local leaders to enforce the current executive order. Enforce the rules that we have put in place to keep employees and customers safe at local businesses. Enforce the provisions that ensure folks are staying 6 feet apart at large gatherings. Enforce measures to protect the medically fragile. And use your bully pulpit, your social media challenge, and your connections with the local media to help build support for wearing a mask when needed. For our local chambers of commerce, Rotary clubs, and other community organizations, please help us echo this call. Encourage those you represent and urge those you serve to double down and mask up. This pandemic has threatened the health and well-being of our friends and neighbors, creating economic hardship that we haven't seen like this in a very long time. Businesses are literally on the brink of bankruptcy. Thousands have filed for unemployment, and many are left wondering how they will put food on the table, as General Cardin just mentioned. To make matters worse, some had decided to play politics by exploiting these difficult emotional moments for political gain. Yesterday, we filed a lawsuit against the city of Atlanta on behalf of business owners, their employees, and hardworking Georgians throughout the region who continue to struggle to make ends meet. Men and women have seen their paychecks disappear. Fathers, mothers, sisters, and brothers are barely hanging on. Mayor Bottom's mask mandate cannot be enforced. but her decision to shutter businesses and undermine economic growth is devastating. Atlanta businesses are hurting. Violent crime is up, and families are rightfully worried. Just like sending in the National Guard to protect those living in our capital city from crime and violence, I refuse to sit back and watch as disastrous policies threaten the lives and livelihoods of our citizens. We will fight to stop reckless actions and put people over pandemic politics. In closing, I'll leave you with this. We all know it's been an incredibly tough year, and that's quite an understatement. This crisis has threatened our health and well-being. It's undermined our economic prosperity. There is justice that we've seen with our own eyes that must be fixed. There's violence that must be quelled. And when I travel the state, I hear the stories of pain and suffering. But I still sense optimism. And I know that all hope is not lost. I am confident that we are going to weather this storm and we will emerge better for it. I have faith that every Georgian will do their part in the days ahead. I'm confident that we are stronger now than we've ever been, and we cannot let politics divide us. I know that our best days are not very far away, and I also know that we live in the greatest state in the country, in these United States. We can overcome obstacles ahead of us. Be strong and courageous, as the Scripture tells us. Hunker down and keep chopping. Thank you very much, and we'll open it up for questions for any of us that are here this morning.
Good morning, Governor Kemp. Thanks so much for taking time to speak with us. Tyreek Wynn with Tyreek on the Move. My question to you is, obviously there's been a lot of things to take place within the past 24 hours. You said you don't agree with a mask mandate and making masks mandatory, but there are lots of pros and cons to different situations. So my question is, what are the cons that you see into making masks mandatory? And I guess, like, how is making masks mandatory hurting people?
Well, it's like I said earlier, I don't believe Georgians need a mandate to do the right thing. You know, Dr. Toomey and I have been on the road for the last 2 weeks encouraging Georgians to wear a mask where they can't socially distance when they go out in public. But I also have been telling local elected officials that we've had current orders that have been on the books for months now that worked before. They'll work now. We just need to enforce them. But this is not about masks. We all agree it's good to wear a mask in the right situation. This is about protecting the livelihoods of our citizens. I was told this morning that California's unemployment rate is 17.5%. Ours is 7.5%. You can check my numbers to make sure I'm right, but I'm pretty sure it's in that ballpark. That is because we are fighting two battles. And we continue to fight 24/7 with this whole team over here to protect the lives of our citizens. And we have done that before. Albany, Georgia is a great example. That community embraced the guidance that they were getting without mandates and flattened the curve. And they did what I'm asking people to do now, and that's encourage people to wear a mask. And we sent masks down there weeks ago for them to hand out to their citizens. We need our citizens to be the solution to the problem that we're facing right now. And they have my commitment that I will stand every single day to make sure that we have the resources we need in our state, from hospitalizations, from PPE, and other things to make that happen.
Good morning, Governor. Thanks for answering our questions today. You said a minute ago that you thought Mayor Bottoms was playing politics with her mask mandate. Are you the one playing politics, and what does the lawsuit say about your priorities given the rise in the COVID numbers?
Well, my priority with the rise in cases has been very clear for weeks now. You know, if you look back of what happened and when, you know, some in the media are accusing us that we reopened too fast. We were open for 2 months before this latest rise, and if you look at when it started, I think there's several reasons for that. Number one was the demonstrations. Number two, because of the demonstrations, that sent a message to people that, hey, it's all right to get out again. We can let our guard down. We got this thing beat, and I think we're all guilty of that. I'm not trying to point any fingers at anybody. My focus during that time was to keep our city from getting burned down and protect the protesters that were protesting peacefully as they did at the Capitol, and we worked with those groups to do that. But this is about the lives and livelihoods of all Georgians. And when you have decisions that literally take away someone's ability not only to operate and create confusion, but also to have them calling us saying, we got food in the freezer, we got food in the coolers, and if we shut down, that money's all gone. You know, that's not the right way to handle this. I'm moving forward on guidance, as I have from Dr. Kathleen Toomey and our whole team, that literally is in conversations daily and weekly with hospital CEOs, the business community, local elected officials. And we can argue about a mandate for a mask or not, but all the people arguing agree people should wear a mask, and I agree. I've been doing that for weeks. Dr. Toomey and I have been on the road doing that for weeks. But we also have to protect the livelihoods, because when I've been talking to the hospital CEOs, they are saying we cannot shut down again. We cannot survive what we went through before, not doing elective surgeries. It's bad for their financial stability, but it's also bad for all those Georgians out there that put off critical procedures, screenings, and other things for weeks and months because they were scared to go out. We know so much more now than we did. People don't need to be afraid to go get a medical procedure at a hospital. It's probably one of the safest places you can go because of what they have learned and how they're handling COVID and non-COVID patients. And I would urge them to continue to do that.
Good morning, Governor. Thanks for taking our questions. I was hoping I could just get your response to Mayor Bottom's tweet yesterday regarding that perhaps the taxpayer dollars would be better spent on contact tracing and testing rather than legal fees. And then also in terms of the other cities who have mask mandates, if they continue to defy your executive order, will you also sue those cities?
Well, the mask mandates are unenforceable. And what people should be thinking about is the livelihoods of those businesses, those hardworking Georgians that are in those businesses. They are paying the taxes that we are using to respond to this, as well as CARES Act funding that we've gotten from the federal government, which we very appreciate their relationship in helping us with the response. But if we shut our economy down, I mean, I remember the press writing at the start of the ramped up session after the suspension about how devastating the budget cuts were going to be. Imagine if we do that again, what they're going to be like. We're already in a very tough position for our state agencies, for our schools, and for our universities. So we have got to balance both of those things. We cannot be afraid of this virus. To be smart and to be scared of it, that's a good thing. So you should wear your mask. But we also have to learn to continue to operate. And I will tell you that there's many businesses that have been able to do that for months now and have not had any problems. And that's why we're working so closely with Dr. Burke, Superintendent Woods, Dr. Toomey's team, and Dr. Redfield on school reopenings, as well as our local superintendents and educational leaders.
Governor Kemp, good morning. Archit with Nexstar Media Group. A short while ago, Mayor Bottoms spoke about the research, saying that Governor Kemp and the team are not using data from the CDC and Emory and only relying with Augusta University, the state-run university. How do you respond to Mayor Bottoms' criticism of not using science from those institutions?
Well, I think it'd be a false statement to say I'm not using science. There's a lot of data out there. We have a great director of the Department of Health, Dr. Kathleen Toomey, that's been a 40-year epidemiologist. She's worked on things like this, obviously not COVID before, but other things that are very much like it for over 40 years. You know, she's worked with Dr. Burks before. She has a great relationship and has known and worked with Dr. Redfield at CDC. So to say something like that, I wouldn't agree with it. Look, people can disagree. We had orders early on that, you know, local officials agreed on. The mask situation is another one. You got some governments that want you to mandate it, others local governments are telling me, thank you for doing that. We're working to pass resolutions to urge people to do that. We're handing out masks. I mean, there's a lot of ways to tackle this problem. We all agree people should wear a mask. But when you have those same politicians that then start deploying actions that want to shut our economy down and destroy our local communities and our local businesses, I mean, I'm just not going to stand for that. We have to fight two battles for the lives and the livelihoods of our citizens.
Yes, sir. Good morning. Thank you for taking our questions.
Morning.
Blaine Alexander with NBC News. You mentioned that Georgians don't need a mandate to do the right thing. My question, though, is looking around, just around different places in the state, there are still people who, despite your encouragement, are choosing not to wear masks. So my question to you is there a point at which you will go from encouragement to enforcement, to mandating? If 1 week from now, 2 weeks from now, observations show people still aren't wearing masks, are you open to changing your mind and making this a requirement, sir?
Well, first of all, I can tell you what I've told people for months now is that I'll continue to listen to the guidance of Dr. Kathleen Toomey and her team every single day like we've done for months now. The second thing is, I'm sure you are aware, there's people that are on our roadways that don't follow the speed limit. So we have people that don't follow government laws and mandates. But when you have existing executive orders that have been on the books for weeks and for months now, that the local elected officials asked me for enforcement powers early on so they can enforce when they were so worried about this, they now have not been doing that. So to add another mandate that's not going to be enforced in communities that haven't enforced other orders, in my opinion, is a failed policy, and we shouldn't have to ask people to do the right thing. We need their help. We're asking them again for 4 weeks. Wear a mask, socially distance, wash your hands, and follow the guidance that Dr. Toomey and her team have given me to put out for months now. It worked before. It worked in Albany, Georgia. Nobody really followed Albany. We obviously did. We were working with them 24/7, literally flying PPE down there, personnel and supplies, and General Cardin and Homer can speak more to that as well as Dr. Toomey about that response. But they were as bad a hot spot as anywhere in the country. When you look at the numbers, as bad as New York, New Jersey, wherever. And we didn't have a mandate down there. Nobody was even talking about a mandate there. I actually talked to the chairman of the commission down there, and I asked him, I said, do you want me to take further action, just regarding Albany and Dougherty County? And he goes, no, I don't want to be singled out. We can tackle this problem at the local level, and they did. They did a great job.
I guess just very quickly, sir, would not mandating it, though, at least send a stronger message, strengthen the message that you're already sending about the necessity of masks?
What kind of message does it send when you have mandates already that people aren't enforcing? It sends the message that the mandate doesn't mean anything. I'm asking people, government is not going to be the answer to all people's problems. I have grave concern about our young people and other people getting so reliant on the government that we lose what the basis of this country was found on, and that's freedom and liberty and opportunity for anyone. And everybody has that liberty to do the right thing right now, and I'm asking them to do it, and that's to wear a mask. But even before the whole mask issue came up, you know what works better than anything, better than a mask? Social distancing, and don't put yourself in a position where you can spread the virus.
Governor Kemp, good afternoon. Haley Mason with CBS 46.
Morning.
Two-part question. Are you aware that Mayor Bottoms says that business owners asked her for a mask mandate for their safety? And then also in the executive order, the lawsuit rather, it says that municipalities are not abiding by the executive order, which limits social gatherings to 50 people. Mm-hmm. But then it also calls for bars and clubs to be open. So asking you, who was to enforce that 50-person limit in a place where, like a bar or a club, where it's counterintuitive to social distance? Who's responsible for that, especially in a city like Atlanta?
Well, any post-certified officer in the state of Georgia has the authority to do that. Police department, sheriff's department, all the state officers, we've done that early on. We've actually responded to calls early on about restaurants when we first started back open that didn't adhere to the social distancing rules, and we sent the state patrol out there. We've worked with local officials on those kind of things too, when we had some churches that were opening early on that weren't following the guideline. And you know, nobody wants to do all that. We want people to comply with the orders. But, you know, the mayor can instruct the police department. If she thinks there's a problem in bars in Atlanta, our bars are under a 35% occupancy capacity. We haven't moved that since we opened it. And the reason we have that policy is because we believe that with that occupancy level and the other regulations we have for bars and restaurants too, that people can socially distance and they can be smart about doing those things. Now, does it make sense to go to outdoor bar if you can? It does to me. But we also know that, you know, we've had 400 and 500 people in the middle of streets in downtown Atlanta with people doing donuts with cars, and that's way over the 50-person gathering ban, and nobody bothered to respond to that.
Is there consideration?
So I think we've got to be consistent about what we're doing. I mean, we're willing to continue to work with the locals on enforcement and to help them, and I would ask them to do that. And I don't think it's going to be as hard as some of them think they will. But we've had local law enforcement that's actually said we don't have enough manpower to enforce a mask mandate. And I don't think we need to do that, in my opinion. I know people disagree with me on that, and that's fine. But we all know the current regulations that we've had for months have worked. So if we get people to enforce those, and you know, as Colonel Val and Lieutenant Colonel Wright and others from the State Patrol, DNR, working our beaches and state parks, we didn't have to write many citations. We wrote several, and we closed a few businesses down because they didn't listen to us and just were being combative. But most people just wanted to make sure they knew how to follow the rules, and they did that. We need to double down on that because it's worked before and it'll work again.
Thank you, Governor.
Thank you.
Morning, Governor.
Morning.
A report from the Center for Public Integrity obtained a document from the White House Coronavirus Task Force saying that Georgia is one of 18 states in the red zone and has recommendations that Georgia is doing, like protecting nursing home residents and investigating outdates, but others it's not. The White House Coronavirus Task Force recommends Georgia allow local jurisdictions to have stricter measures and also recommends that there's a statewide mask mandate. Why, have you seen this report, and why is Georgia not following the White House Coronavirus Task Force?
No, I haven't seen the report. I agree people need to wear a mask. You know, I don't think it takes a mandate for people to do the right thing.
Good morning, Governor.
Morning.
5 of the 6 largest school districts in Georgia in the last 10 days or so have announced that they're going to all remote instruction to start the year. Are you okay with that?
No, I actually think kids need to be in the classroom. I think there's a safe way to do that. I know Dr. Burks, Dr. Redfield, some educational folks from around the state that we've been working with at the local level. Dr. Toomey and kind of our whole team yesterday had a really in-depth conversation with that. And Dr. Redfield actually had some really good points to make, and I think Dr. Burks is going to be working on getting us some of that information that we talked about. I think look, I understand the concerns from parents. I understand the concerns from teachers. I'm very appreciative that literally all those folks, including our kids, have been through, you know, people missing graduations and just having their whole world turned upside down. They don't know what to think about all this. There's bad outcomes of not having kids in classes from a nutrition standpoint, child abuse, human trafficking, you know, and other things that go on. So I'm a believer that kids need to be in the classroom. And we're working with the schools to do that, and we're working with them to make sure that their communities and their parents and their teachers are comfortable with that. And that's something that we'll continue to work with the task force on, but also our local leaders as well. The local leader that was there yesterday had some really good ideas about how we message that. And he actually told me that his team, they did a survey, and you know, 88% of the kids want to come back, the kids and the parents. So I think there's a lot of support out there to do that, but also know that, you know, when the newspapers and the media only write about one side of the story and are not writing about really the lack of risk. I mean, everybody's having risk. People that have been working in grocery stores through all of this, people that have been in critical infrastructure jobs go to work every day with risk. Our law enforcement, Atlanta Police Department, State Patrol, National Guard, protecting peaceful demonstrators and going after those that were disruptive. They face risk every day to the coronavirus. So, we have to be very smart about how we do this, and I think the guidelines that Dr. Toomey and her team have been working on to work with the state school board and these local schools is going to be helpful for that. And, they have my commitment that we're going to continue to do that in the days ahead.
Do you anticipate or any executive action to encourage or require in-person instruction?
Well, I wouldn't really want to speak to that. I haven't really thought about that. I think our schools are trying to do the right thing, and it's my hope that we'll get kids back in the classroom. I personally think that once kids start going back, and like Richard said, look, it's not going to be easy. There are going to be challenges, but every new school year has a challenge. We're going to have cases that break out in the schools, either with personnel or perhaps students, just like you do with a stomach bug or a flu or anything else. Our schools know how to handle those situations. Dr. Toomey's been working with them on what the protocols are for that, where you don't have to shut the whole school down. And the risks, as Dr. Redfield talked about yesterday, are very, very low. For those that are medically fragile teachers or administrators, I believe there's ways that the school districts can use them either with virtual learning, course planning and other things to just make it work. And we continue to work with them on that.
Thank you.
I actually have a question for Dr. Toomey.
Oh, great. I need a drink of water. Dr. Toomey.
Hi, Dr. Toomey.
Yes.
I'm Emma Hurt with WABE. I'm wondering, you and Governor Kemp have said that the current level of testing is unacceptable. Seems to be something we can agree on. Local health officials say that that effectively keeps them from contact tracing. Why has testing failed us? And we understand that private labs are backed up, but other than that, why has this it seems like a basic public health tool not been working? It seems like other places have figured this out, and why haven't we?
Actually, I don't think that other places have done any better. What's happened is demand for testing here and in virtually in every other state has gone up. And when the demand has gone up, we need to increase our capacity. And so we're working very closely with our health directors. We are working as a team across the state. And that, as a team, we're looking at how we can make our test sites more efficient, even increase the throughput of our test sites. Even though some of our test sites have 4 lanes of cars, we have to even do better. We have access to plenty of test kits, test materials, so it's not a lack of access to swabs. It's just having enough spaces available for appointments, and that's why we're trying to improve efficiency and even get additional partners. The group CORE that was partially funded by the Blank Foundation has picked up testing here in Atlanta as well as in Cobb and Gwinnett. So they're helping us with additional testing. And so it's trying to be as creative as we can at a time, not just here, but in many, many states. I talked to many of my fellow health officers. They're seeing similar challenges. There's an increased demand like we've never had before. And so it's doing all those things and working smart and ensuring that we have the most efficient test sites that we can. But we can't, when those tests take 2 weeks to come back or longer, that's not our fault, but we have to deal with those consequences. And I've said many times, it's unacceptable. We can't do COVID prevention with that kind of turnaround time, and so we're working hard to get additional testing capacity to improve that.
Is there something the state can do to influence private labs and their turnaround times?
Well, I think we're voting with our feet. We're getting new labs. So, I think there's a recognition that there's a problem, and all the states are pouring their tests in, and so they're backed up. But our own public health lab, which is working at capacity, can do 3,000 tests a day, but it was never built for this kind of throughput, where we're looking at 10,000 or more daily at some of these commercial labs.
Thank you.
No, thank you.
This one's also for Dr. Toomey. So the governor said that it's, pretty much inevitable that there are going to be cases in schools. I'm just wondering, could you provide some clarity, when a child tests positive, who should quarantine? Should their classmates quarantine, busmates, people in the clubs? Who's going to make that determination and who's going to enforce it?
No, I'm very proud of the guidelines that we developed. We developed these guidelines with school nurses, with epidemiologists, in partnership with the Department of Education. And so I'm not going to say you do this or that. Really, every situation is unique. It will depend on the classroom situation, how many people may have been exposed, what's the size of the classroom, all those factors that may contribute to spread. And so we will take it on a case-by-case basis, and we will be working together in partnership, both the state and our local public health officers. They have been with me. They have been reviewing these guidelines. The guidelines are online, as the superintendent said, but we will make those decisions based on the situations in every school. Every situation will be different. When we first started with this in March, this was new to us. And I said on many of the calls with the schools, we are learning as we go. This will be the first school year that we've dealt with it like this. We will work together and learn from this, but really be very, very careful and follow what I believe are very careful guidelines that are consistent with the CDC guidelines and other guidelines, such as the Academy of Pediatrics. But the flu season comes every year. Schools close, schools make decisions, and at some point down the road, I think COVID will be as routine for us in the schools as the flu is every year. Right now, though, we are following guidelines closely and intend to work one-on-one with every school and not just have a blanket decision-making process.
Will schools have the authority to mandate that children stay home for 14 days if they're exposed?
Well, there's the guidelines are that if a child is exposed, there is a requirement to quarantine, just as any other situation. But how many people are exposed really is a determination made by the epidemiologists working closely with the schools, because not everybody in the classroom is considered to be exposed. An exposure is a close contact for 15 minutes or longer, and that's not the case. And I think many schools are actually trying to distance the teachers to minimize their exposure, and looking at how they can distance the desks as well. I mean, we're trying to be very creative, even suggesting things like using some of the alternative rooms like the gym and other large facilities within the school building to be able to spread students out. Have the students stay in a classroom as a cohort and have the teachers rotate rather than risk exposures. And so we're working very closely with them, but we don't have a one-size-fits-all approach other than the mandate that when there is known to be a case or a cluster, that gets reported to us so that we can work together with the school.
Thank you.
Governor, you're back up. Governor, at least 24 states have imposed mask requirements. Several other, including some Republican-led states, several other governors have allowed locals to do their own restrictions. You say you're worried about the economic impact of these restrictions, but where does that fear come from if so many other states, more than half the states in our nation, have adopted similar restrictions?
Well, a good example of that is, I think what the mayor was doing the other day with wanting to shut businesses down. Sending that message to people, that creates economic hardship. There's no reason to do that right now. Dr. Toomey has not said that we need to do that. You got the mayor of Savannah that's put out some messaging saying that businesses need to, he's going to require businesses to enforce the mask mandate. Businesses don't have time. They're barely hanging on now. They can't be some city's police force. I mean, we are focused on two things: the lives and livelihoods of Georgians. We can fight both those battles. I personally don't believe we need a mask mandate to do that. I agree everybody should be wearing a mask. I'm urging them to do that. But I'm also urging them to do the other things that we've had for months now that nobody's enforcing at the local level that worked before. Social distancing, enforce the large gathering ban, and make sure the local businesses are following the regulations that have worked in the past and will work in the future.
And a very quick follow-up. The mayor, of course, you're suing the city of Atlanta, not Savannah. The mayor of Atlanta says that her phase 1 guidelines are recommended. They're suggested. They're not mandatory. What do you say to that?
Yeah, I saw that this morning. That's not what she said when she put those out, and we had literally, the restaurant association here freaking out because they all thought they were going to have to close that night. That sends a terrible message to people, and that is one reason that I'm continuing to take the position, and this is nothing new in the executive order. It's been in there for months, that the locals can't do anything more or anything less, but they do have the power to enforce the existing guidelines which have worked in the past, and they'll work now if people will enforce them and follow them. And that's what I'm asking all Georgians to do, and I have great confidence they will. I've traveled quite a bit the last couple of weeks around the state. I've gotten my hair cut 4 or 5 times now since we opened back up. I've been to restaurants. I've ridden through some of our coastal communities. I've been to other events, and it's a lot different with people wearing a mask now than it was, even 2 or 3 weeks ago, and I believe that will continue to be the case. And as I've told people on the road, if you want to help your local hospital out, wear a mask. If you want to help your local businesses out, to us not going back to where we were, which was complete devastation, wear a mask or socially distance yourself. Just, we're asking people to do this for 4 weeks, and let's flatten the curve again. It'll give the hope of us having a college football season, and that's something that our young people, one of the things that I talked to Dr. Redfield and Burks yesterday is like, how do we message to the young people? So if you have a strong social media platform and you're in that 16 to 35 age group, if you can use it, encourage people to do the right thing, to follow the guidance, that will be very helpful for us. Because I think early on, kids thought they were immune to the disease, they wouldn't be affected, and thankfully most of them are not. It's not hard hitting on children, even though we have had some fatalities, which is tragic. I believe they were with comorbidities. But what they don't think about is infecting others. And this is what I told our team well over a week ago, is what else do we need to be doing in our long-term care facilities and in our nursing homes to continue to work with them. We had a call yesterday with the association to make sure people are following the guidance and the guidelines. Because if an asymptomatic young person infects a healthcare worker in a nursing home, that can be a deadly scenario, and that's the severity of this, and that's why Frank's team is going out and doing these inspections. Director Verma was on the call yesterday at CMS, so we have talked about that. That's why General Carden continues to do everything he can in not only doing the infectious disease cleanings, but also training their personnel at those facilities how to do that themselves. And then also our testing plan, and that's something else that we talked about yesterday that the White House Task Force is working on, is a testing platform and plan for our long-term care facilities. I was very excited to hear about that. It's going to take a little time to ramp that up, but that will be awesome if we can get that done.
Thank you, Governor.
Governor, I guess the question is there sort of a line in the sand, an ultimate warning to Georgians if they don't follow the mask recommendations, if there is not enforcement of these executive orders? Is there, I guess, an ultimate kind of warning that we may actually have to go back to a shutdown? And at what point are you going to look at this and say,
Well,
maybe it's time?
Richard, I continue to keep all my options open. I'll continue, as I do daily, talking to Dr. Toomey and her team on recommendations. But I believe our citizens are adhering to what we've been telling them over the last 2 weeks. And I think the good thing about the controversy and my position on fighting for lives and livelihoods of Georgians is continuing to raise awareness that everybody agrees you should wear a mask when you're out in public. And I would ask people that just fundamentally don't agree with that don't want to do it for whatever reason, just socially distance yourself from people. Be smart about, when you're shopping or when you're going out in public, and stay away from people so you don't infect them. I mean, that's why you wear the mask, is to keep me from affecting or infecting someone else. And I think that if we do that for 4 weeks, we will flatten the curve, we will stop the spread, and we can continue, as we've done, to methodically reopen things. But, if we don't do that, we're going to be in the same situation now in the fall, and people are going to be going, man, it really sucks that we're not having college football season. I mean, that's what we're facing. And, Dr. Adams, I thought, made a great statement to people about their liberties. And as you know, I feel very strongly about that. But he also said, if you want to have liberties in the future, wear your mask now so we can get back, to where we can have college football, where we can have, you just think about these high school kids. I mean, you had kids that missed their senior year of soccer, football, cheerleading, graduations. I personally think that's terrible for our kids. We don't need that to happen again. We need them to follow the guidance just like everybody else, and we need our parents to stress that to them. And if we do that, we'll have better days ahead. I'm very optimistic of that. Thank you all very much.
Governor Brian Kemp, along with other state leaders, hosting a press conference on the fight here in Georgia with COVID-19. It's been going on for the last hour, 15 minutes or so. A number of highlights to bring to your attention here as we wrap up our coverage. The governor, of course, talking about this big story over whether Georgia would have a mask mandate, and him filing a lawsuit against the mayor of Atlanta and the city council, effectively banning Atlanta and other cities and counties from enforcing and implementing a mask mandate, and also other COVID-19 restrictions. The governor saying that he filed this lawsuit on behalf of business owners, those hardworking Georgians, and that it cannot be enforced, and the decision to shutter those businesses, in his words, is devastating. Again, talking about the order from the mayor of Atlanta and it being approved by the Atlanta City Council. So the governor says that it is up to the community to defeat the virus, not the government. He spoke on this endlessly, asked many questions about why Georgia does not have a mask mandate. Would he consider issuing one in the future? He says he's always open to ideas moving forward, but for right now, he doesn't want to rely on the government. He wants it to be up to us to make sure we wear our mask. 4 things in 4 weeks he wants all of us to do: wear a mask in public, practice social distancing, wash our hands, and to follow his executive order, all those guidelines in place, talking about limiting social gatherings, 35% occupancy rates for restaurants and bars, making sure the medically fragile, that they stay in their homes, they're not out and about. They also spoke about schools, and a number of schools, 5 out of 6 school districts in Georgia have now decided to start the school year with the students and teachers at home, doing the online learning. And the state school superintendent says that he can assure all of us that our kids will be safe. The risks are low, they say, but again, a number of school districts have decided otherwise, as all of our state leaders are working in place to make sure that these schools get all of the equipment they need moving forward. And lastly, as far as testing, we've seen a number of people waiting in long lines to get tested. We've seen some of these test results taking up to 2 weeks to get back. And so both the head of the Department of Public Health and the governor speaking on this. The head of the Department of Public Health, Dr. Kathleen Toomey, talking about an additional lab being brought brought in, and also the governor talking about an announcement in the next few days about a new partner coming in, providing 10,000 more tests per day. Also an effort to increase the number of contact tracers by up to 2,000 in the next several weeks. Right now, there are 1,300 contact tracers, and that should help with the fight against COVID in Georgia. I want to thank you so much for watching our special report here on 11 Alive. I'm Sheba Russell. For these stories and more, be sure to download the 11 Alive app, and of course, we'll have more coverage for you at noon.